Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Hey, Bobbi. It's great to see you as always.
As always, great to see you as well. Well, lots of things going on since we last met, and of course, lots of things going on in my world of infectious diseases.
Yeah, I know infectious diseases continue to be in news, with the number of pathogens that are showing some very high levels. I think
Hmm.
influenza is one, and there's been a lot of attention in the measles outbreak. I think one in Texas and that's gotten some attention. So, and it was still the H5N1, the influenza, avian influenza virus also continues to
Hmm.
make news. So yeah, lots of things in your world that are kind of percolating.
It's always exciting in my world. Well, let's talk a little bit about those because I think it involves all of our listeners, people just for their own personal risk, their family's risk, but also for those in the lab testing world, how we detect these organisms in the laboratory. And perhaps we could start by saying, you and I have talked about the so-called quademic that's been happening because we have flu, influenza A, but then there's also COVID-19, there's norovirus and RSV. But of those now, it really looks like influenza A out of the four is really been particularly bad this year.
Yeah, I've seen that as well. It is kind of it just brings you back, right? Because I think back to the days of when we were in the height of the COVID pandemic and there was essentially no influenza for that. And so, but clearly it was still around and it's made a very strong comeback this year. So, unfortunately, to say the least.
Yeah, I don't think it's probably going away. It did go down tremendously in numbers during COVID, and that was probably because people were social distancing, they were wearing masks. Influenza is a respiratory virus that's transmitted in the same way as SARS-CoV-2 is. And now it's a particularly bad season, high severity for all age groups. We haven't really been seeing that for many years now. Emergency department visits are high, hospitalizations are high. So definitely something that people need to be thinking about.
Yeah, and I mean, I think there's some schools of thought about why and what's behind
Mhm.
this, right? I know there's certainly the number of people who got vaccinated this year for influenza was lower than in previous years, and I think that's
Mhm.
certainly part of it, but maybe not all of it. I'm not sure as a microbiologist what your thoughts are there.
I think it's definitely a contributing factor. I think also the vaccine isn't a perfect match. It has a lower efficacy against preventing hospitalization with severe illness than we've seen in some past years. It's always hard when the vaccine makers try to predict what the circulating strains will be and then make that vaccine. Sometimes they get it spot on, and sometimes it's not a perfect match to the circulating strain. So that may be playing a role. But even still, we know that even without being a perfect match, the vaccine is still protective. And it does look like fewer people got vaccinated this year. And then, as you already said, the COVID precautions, people aren't social distancing as
Yeah,
much. They're not wearing masks, and that also is likely contributing.
yeah, it is. I mean, it's we see this um, not just in our world, but really across the country, probably across the globe, is that, we've talked before, we've got kind of the COVID fatigue, if you will. So people really, no one, I thought maybe no one, but very few people enjoyed wearing masks or doing other things. Of course, there's
Hmm.
a push now for people to return to work. There's not as much remote work or there's kind of this pendulum swinging back. That being said, all the things that we did as best practices during COVID are things that we should keep in mind. I mean, if you're not feeling well, avoiding others, wearing a mask if you're out, particularly if you have symptoms, you should be wearing an N95 if you need to go out, or something similar that will prevent you from spreading. So, but any mask will help with droplet spread viruses like influenza. So yeah, it's a bit unfortunate. It'll be interesting to see. I travel by air again tomorrow. I have seen some increase of people kind of masking in
Hmm.
group settings. So, but by and large, you're right. It's unfortunate that it's just People don't, it's not front of mind anymore. Understandable. Hopefully we can kind of get back to a reasonable place where we can learn from some of the things that have happened in the last 5, 6 years and be a little bit better about preventing the spread of these pathogens, because they can cause serious illness, right?
Yeah.
Um,
Yeah,
so
increase in hospitalizations. And again, like I said, the CDC is really rating this as severe across all age groups, not just the elderly and the very young, which are the typical groups at risk, and those with pre-existing respiratory conditions. And probably you've heard of people, I've heard of people, I've had a lot of family members and friends that said that they were out of work for a week. So maybe it didn't put them in the hospital, thank goodness, but it still has a significant financial input to these people or outcome. So
yep.
not something you want.
That's something you want. If and it's a there's still a role for testing as well to confirm what you have. There's COVID is still here as well, and I know there's been COVID is circulating, and I know a number of people personally that
Mhm.
have gotten sick with COVID, and they're getting really sick with COVID and also being out of work for several days. So, but one of the pathogens which is concerning to me really is measles when you talk about serious illness, and
Yeah,
again, because that can have lifelong. Um, Neurologic
very
effect.
serious.
Can
Yes.
be very serious. We should definitely touch on that one too.
Yeah, let's do that. It's funny, people think of measles and they think, oh, just a rash, right? Because that's one of the predominant symptoms, and it's the cough, the coryza, the conjunctivitis, the Koplik spots, and the rash. Those are the typical symptoms we think of. But there's a lot more. A large proportion of people that are infected require hospitalization, and then, as you said, there are these very serious complications involving the brain and spinal cord, and people can end up with fatal encephalopathy. It's not benign. People die, and they used to die in large numbers from measles. Very, very preventable. The vaccine that
Yeah.
we have is greater than 90% efficacious in preventing disease. And I will say that measles is one of the most infectious diseases known to humankind.
Yeah, yeah. So it's unfortunate we've kind of seen this a bit. I think an after effect of some of just dropping in vaccination rates, and it's really important. I think
Mhm.
what happens is too is that it's sort of out of sight, out of mind. So people forget. I mean, I'm old enough that when I was, the people that taught me in medical school had seen some of these viral pathogens like measles really have a profound impact. And so, as you said, it's when you always use this as sort of a comparator during COVID, for instance, just about how spreadable when we were talking about aerosolization and how spreadable
Mhm.
measles is compared to others. And so, yeah, really keep this in mind. Don't let the fact that we haven't suffered from these outbreaks kind of let your guard down, because now I'm sure there's quite a few people out there who wish they hadn't. And so it's important to protect, yourself, your loved ones, and of course, you help prevent, especially with measles, you help prevent the spread, right? That's part of why we're seeing it, is that, and that's how vaccines work. A certain proportion of the population, it becomes unvaccinated or not immune to the illness, and then you reach a tipping point where now the infection can really start to spread and put people at risk. So something definitely to keep in mind. And our tools that continue to advance, even going back to influenza. Of course, that's why there's the push on the RNA vaccines that have been around for a long time,
Mhm.
now just really made it into being used clinically. And that the thought was because they're more adaptable than the traditional vaccine type in terms of responding. As you said, with the influenza vaccine, by traditional methodology, you pretty much have such a long cycle that you can't really respond. From a
Mhm.
vaccination perspective to changes. So all things that hopefully we can kind of continue to learn, continue to put best practices into place, and most importantly continue or keep people safe.
Yeah, absolutely. Yeah, very powerful, very safe vaccines for many of these diseases. And like I said, some of these diseases may not kill you. Some can, though, and many will put you in the hospital. They have severe side potential complications. So the measles outbreak right now, I've seen it in multiple states. Texas is the big one. 43% of patients required hospitalization.
Yeah,
That's a
wow.
large number. That's almost 50%. Hmm.
That's yeah, that's very disconcerting. So, well, and just for our, for us, in the healthcare profession, it's important that we just share information that we know with people. So, I mean, that's a big part of our role is just to be a trusted resource for people. There's so many different places for information. So hopefully that's why I so enjoy being able to come on with you and talk about these things. Hopefully people find this helpful. But for all of us, I think it is really important that we don't lose sight of that part of our role in healthcare in terms of just educating and being a source of information.
Yeah, absolutely, Bill. And I think being able to point people to reliable sources of information, the CDC is outstanding. You can see their COVID tracker. They'll give you the week by week influenza statistics. You can also go to your state health department. And if you want, you could even sign up for updates. I just received one right before I started talking to you from the Minnesota Department of Health. And they're a great resource for testing as well. Some of our listeners may be thinking about how do we even test for measles? And if you're trying to detect acute measles, you probably should be calling your state health department because they're going to be performing that testing. That's different than the antibody tests we do to see if you have existing immunity to measles. The state health departments and the CDC have also recently said for patients that are have severe disease, hospitalized with influenza, they want those people's specimens sent to the CDC testing for H5N1 because of the concern that it might be avian influenza.
Yep. Yeah, and maybe that's the last place to subject to discuss this one is what's the latest with avian influenza, as it's so called. I've seen some reports that it has been detected in the milk of some dairy cows. Doesn't mean that people will catch it from milk, but I think it does show that it's circulating now in that species type in the U.S., which I think also raises concern about spread to human. So it's just something and human transmissible disease, most importantly, that human spread, that if it continues to evolve. And of course, that's one of the dangers of having high levels of influenza type A as well, is that the more these viruses are circulating, that's how the ecosystem of viruses works, as I understand it. They can actually exchange genetic information, if they're co-infecting an individual. So, and that's how we see some of these evolutions and changes, which can have serious impact on human health. So, lots of good reasons to try and stay safe.
Yeah, right now, the public health labs still say that there's no reason to panic about H5N1 or H5 avian flu or bird flu, as it's variably called, but they're keeping a close eye on it because, like you said, we're seeing these genetic changes. The strains that are infecting cattle and birds are changing. There's definitely been human cases. Not all the human cases can be traced back to a clear-cut exposure to an infected animal. And as you said, there is this concern when it's this season, you have human H1N1, H3N2 circulating, and then you have H5N1, and you get an animal like a pig, which is the great mixing bowl of influenzas. Pigs can be infected with human and avian strains, and then there could be reassortment. And then you can get just very large changes, brand new viruses being produced that could cause very serious disease to humans.
Yeah. So bottom line is stay safe. Bottom line is I'm glad there's people like you out there that are helping us to keep an eye on these things, because it's important. As much as we don't want to think about it, we need to continue to think about it. And then we'll hopefully get through this season, and we'll start to see things getting back to some kind of whatever the new normal is. I don't know that we've seen it yet in terms of just staying safe.
Yeah, I agree. Stay safe, folks. I will say that today it was lovely. I think we're getting a high of 40-something degrees, which is much better than the minus degrees that we've been having, minus 20 and whatnot. So I don't think we're seeing spring anytime soon. This is Minnesota after all, and it's only February. But spring will come. Some of these respiratory viruses will go down. But meanwhile, stay safe and protect yourself. Influenza A is probably the biggest concern right now from a respiratory virus threat.
Yeah. And then when spring does come, then we get to talk about ticks and vector-borne infections.
Exactly.
So there you go.
There's always fun things to talk about. Well, Bill, good luck in your travels and stay safe. And we'll talk to you next week.
Sounds great. See you later.
Yep. Bye. Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.